one individual who is an organ donor can save up to 8 lives. These donors and their families are really true life-saving heroes.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, the stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. In today's episode, we're exploring the life-changing impact of organ transplantation and what it takes to guide patients through one of the most complex journeys in medicine. Dr. Sundus Lodhi, a nephrologist at Piedmont Healthcare, specializes in kidney transplant care, shares her perspective on the transplant process, from evaluation through surgery. She discusses the challenges patients face, the coordination required across care teams, and the role of compassion in improving outcomes. In this conversation, Dr. Lodhi offers insight into how transplant medicine is evolving, what patients and families can expect along the way, and what it truly means to deliver life-saving care in this field. First, if you could just tell me a little bit about how you got to Piedmont and how you became interested in the organ donation.
Yeah, sure. Thank you for having me and to highlight this really important aspect of medicine, of organ donation. One of the things that really drew me to want to work in the transplant environment was that it really epitomizes the humanity of somebody giving an organ to save somebody else's life and the impact that that makes on every individual.
That's amazing. How does the Piedmont's organ donation program work?
So transplant centers are really involved with trying to find organs to save people's lives. Piedmont actually has a very robust and growing kidney, liver, and heart transplant program. And these programs really take patients at the time of advancing disease, try to get them ready for transplant, and then add them to the waiting list to find an organ to save their lives. So each organ line is a little bit specific and personalized to what the needs are. The kidney transplant program will see patients who have advanced kidney disease, either almost needing dialysis or already on dialysis, and evaluate them to see if they're medically ready. Once somebody is on the waiting list, we work with them to help maintain their health so that when an organ does become available, we can get them transplanted.
So there's special things that you have to consider when you are preparing somebody for an upcoming transplant that's a little bit different than if they were not looking at that near term?
Yeah, transplant surgery is a little bit different than other surgeries because really our bodies are designed to get rid of anything we weren't born with. So when we're adding an organ from another human into our bodies, our immune systems are going to automatically try and attack it and get rid of it, just like they would normally with a virus or an infection or even a tumor. So we, in transplant, have to manipulate our body's natural response to accept that organ. So a person who needs an organ transplant needs to actually be able to get through the surgery safely and also be able to tolerate being on medicines that will weaken their immune system so that they don't reject the organ. And every person is sort of assessed individually to make sure that that would be something safe for them to go through.
That's interesting. Can you walk us through when someone has been identified as a potential donor? What's that process look like to match with the patients needing donors?
The majority of people who need organ transplants are on a waiting list and waiting for a deceased donor. So somebody who's passed away but identified that they wanted their organs to be donated, or their families have identified that they'd like to continue the legacy of their loved one through organ donation. I think a common misconception might be that transplant centers are involved in finding deceased donor organs directly. Transplant centers really are focused on taking care and assessing patients before, during, and after the organ transplant itself. But the process of finding people who have passed and talking to their loved ones about donating organs is actually handled through a regional center called the Organ Procurement Organization, or OPO. And so the staff of the OPO is actually separate from the transplant center and separate from the treating hospital where the individual might be located.
Obviously, you mentioned that many of the organs donated are from deceased, but I know that there are living donors that contribute to helping patients survive. Can you explain what a living donor is, what type of organs or tissues can be donated while alive?
The most common form of living donation is actually kidney donation. People can donate a kidney. We're born with two, and people can live a very normal life with one kidney. So Piedmont to date has done over 1,800 living donor kidney surgeries and transplanted. So someone who is donating a kidney to another person in need is actually donating something to save that recipient's life. The process is really once they contact us and express any interest, we really put them through a lot of detailed medical and mental health evaluation to make sure that it's going to be safe for them. If someone expresses interest in donating a kidney, our living donor advocate, somebody who's separated from the recipient, will also contact that person to make sure that everything is being done in their best interest. The evaluation to see if someone can donate a kidney really starts with just making sure that their blood work shows normal kidney function, of course. But then beyond that, we go through a very personalized approach to ensure that we have a good understanding of the individual's health risks. And if they don't have any current health problems, we also go through what they know about their family history, any blood relatives. So that allows us to really counsel them in terms of what to expect after donating a kidney.
Is this something that you find that patients are reaching out through their primary physicians, they're reaching out through this procurement center you referenced, or they're reaching out directly to transplant centers if this is something that they're interested in?
Actually, anybody can be a kidney donor. Many people find out about it because it somehow touches their lives, where they have a family, friend, a loved one, or sometimes they just hear about a coworker or a church member that has kidney disease and they've heard that, they need a life-saving organ. We encourage our patients who have kidney disease and are waiting for a kidney to try and spread the word in their own communities about how, healthy people can donate a kidney and it's actually safe and they can go on to live a normal, healthy life. Occasionally, we will have somebody that comes through because they've heard of kidney donation and they'd like to learn more about it, and it's something that they have wanted to do as a life-saving gift. Donating an organ while you're alive allows you to continue to see the benefits of that going forward. So most people will come to us either because they know someone that has kidney disease, or they have learned through community events that it's something that can be done.
What types of concerns do you find that you need to address when someone has expressed an interest in donating, but are a little bit hesitant about it?
One thing I always try to tell people at the very outset is, when we evaluate someone to donate a kidney, we really want to make sure that it's going to not hurt them in any way, and that we will let them know if we don't think it's safe for them to donate a kidney. In other words, we will turn donors down if they come to us expressing interest, but they're really medically or there's psychosocial barriers that would make it not a good decision for them.
That's good to know.
Another common question that comes up early on sometimes is sort of the cost or health insurance piece that's involved. Obviously nobody wants to go through and incur medical costs or have their premiums go up. So another important point is that if somebody comes forward to donate a kidney, the kidney recipient's health insurance will cover any testing that the donor has done, blood work, imaging, consults that we need to get done. The surgery itself and the aftercare after surgery is all covered by the kidney recipient's insurance. So nothing should really hit from a medical cost perspective. Nothing's going to hit that donor's out-of-pocket cost or, affect their insurance. And if they sometimes have to take time off work or they need dependent care, there are programs in place that can help with that financially as well.
I'm glad you answered that. It's nice to know that there's support. Do you have a story that you could share? I know you have to respect privacy of just an example of the life-changing impact of organ donation.
One of my favorite things to see actually with living donation is when somebody comes forward as what we call a non-directed donor. Also, they're sometimes called altruistic donors because they're coming forward to donate a kidney, not to a specific individual, but to the next person who needs one. And oftentimes, what this does is starts a chain of donation. So there are hundreds of people all over the country who need a kidney transplant, and they actually have someone that wants to donate to them, but might not be compatible. Because there's hundreds of people in that situation, sometimes swaps can happen where one person donates their kidney and it goes to someone that they're compatible with. That person had a donor that was compatible, with the person that they would originally wanted to donate to. But when we get somebody who comes as a non-directed donor who says, listen, I just want to give my kidney to the next person who needs it, their kidney will go to somebody that has a donor that wasn't compatible with them. And once they receive the kidney, and then that donor will also donate to the next person who's in that same situation who has a donor that's not compatible. And then that person's donor can donate to the next person. So seeing these remarkable individuals come through and start a donation chain like that is always just so inspiring to see. And, the nice thing about that is it's not only giving multiple people a kidney that they need and to save their life and go on to live a better quality life, but it's also taking these recipients off of the kidney waiting list and allowing other people to come up on the waiting list who don't have living donors and need a deceased donor kidney, and allows them a better chance to get transplanted with the deceased donor organs that we do have. I also want to honor individuals and families who have donated their organs after death. And so one of the things I'd like to illustrate too is that one individual who is an organ donor can save up to 8 lives just through organ donation, but then impact many, many more through other tissues, cornea transplants, for example, giving somebody back the gift of sight. So these donors and their families are really true life-saving heroes, and the impact that they facilitate is not even known sometimes of, how many lives they save and how many lives they actually just enhance. So anyone who can't donate while they're living can sign up to be an organ donor who can donate and help save lives after they've passed away and continue their legacy in a really powerful way.
What is the common way that people will do that? I know that you can indicate it on a license card or with your registration.
Yeah, I think a lot of people are exposed to it maybe when they go to get their driver's license, or that they have to be or they're renewing their driver's license. You do have to be a legal adult, age 18 and up, to indicate that you want to be an organ donor. But you can do it not just with your driver's license, with your hunting or fishing license renewal as well. It gives you an opportunity. Anyone that has an iPhone with the health app, actually, there's a link there that takes you to register to be an organ donor. And if you don't have an iPhone, you can just go directly to the website, which is donatelifegeorgia.org. There's some good information there about, the need for organ donors, but also it allows you to register as an organ donor. And if you want to put limits on what you want donated, you can do that too.
At Piedmont, quality care changes lives. Meet Tom, a lifelong medic who suddenly suffered a stroke at home. Tom was diagnosed, treated, and in surgery within minutes, thanks to seamless coordination across the entire care team.
I've seen firsthand how every second counts. When I needed help, Piedmont moved with speed and precision, and that saved my life. A week later, I was back at home with my family, back to work and back to living.
Hear more at piedmont.org/quality care. Piedmont, real change lives here.
I have a few more questions for you. If you could help share what some of the biggest challenges are facing organ donation programs today.
Probably one of the biggest challenges, this myth of, well, if somebody knows I'm an organ donor, they might not do everything to save my life. And that's really a myth. the treating medical teams in the hospital, even, at Piedmont, we have a transplant center. We are not even aware of who's coming in, who's in the ICUs. That is, the treatment teams do not consider organ donation at all. They don't even ask about it when somebody comes in sick and needs medical care. So every effort is still done to preserve life and save life. It's not until certain very specific clinical parameters are met that the organ procurement organization is even involved. And that would be things like, lack of brain activity or, lack of normal reflexes, really indicators showing that there's no brain activity or imminent death.
I know you mentioned the high number of living donors that have come through the Piedmont Transplant Center, and I know that I think overall there are a very high number of kidney transplants as well as liver transplants that have occurred there, and just maybe you could share some insight into what the difference is in seeking care at a high volume center compared to those that may not perform as many procedures.
Yeah, over the years, Piedmont has really emerged as a national leader in organ transplantation. The kidney, liver, and heart transplant programs have really grown over these last few years. Our kidney transplant program has, to date done over 5,500 kidney transplants. In the last few years, we've been one of the top volume centers in the nation. But that's not necessarily our end game. We want to try and transplant as many people as we can, but we also want to make sure that they go on to live good, healthy lives. And so looking at our outcomes, Piedmont Transplant has also emerged as not only one of the highest volume centers, but also the best outcomes after kidney transplant over this last year. So the advantage of going to a high volume transplant center is that you have the staff with the experience and, you have the surgical teams and the medical teams able to take care of more complex cases. And, that's certainly something that we do across all organ lines is assess higher risk patients that might need a kidney or a liver or a heart or a combination of transplants, and really try to see if there's something we can do to help these patients who are in dire need of these life-saving transplants. Being at a high volume center means that, you also have the staff not only with the expertise, but also the supporting staff with other consulting services available and the latest up-to-date technology, both in terms of surgical techniques as well as medications needed to treat, prevent rejection and also treat other illnesses as they come up.
Well, thank you, Dr. Lodhi. I'm going to leave you with the last word. What message would you like to leave our audience with?
I think it's really important that we continue to honor and remember people and their families who have donated and given life to so many. And I'm also very, very inspired by the number of living donors that have come forward to donate kidneys to patients that are in need. I think anybody can actually come forward to be a kidney donor. We will do the legwork in making sure that it's going to be safe. And if it's not, we'll turn them down to be a kidney donor. But the impact that it makes is really just beyond even that one person who receives the organ. It really has this ripple effect that goes on for that person to live a longer, better quality life. And then also helps other people get transplanted indirectly by being able to move up the list and be next in line for other deceased donor organs. So anyone that's thought about potentially being a kidney donor, I'd encourage them to check out our website, piedmontlivingdonor.org. We've got some information there. And if anyone's interested in just learning to see if they would even be a candidate to donate, I encourage them to fill out the health questionnaire that puts you in direct contact with our living donor team to then figure out if donation would be a right choice for you.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.